The third leading cause of death in the U.S. is chronic obstructive pulmonary disease, and it's actually something that millions of sufferers could avoid. If that fact takes your breath away, that's just how people with COPD feel too. LURENE CACHOLA tells us why women may be at higher risk than men.
COPD, also known as emphysema or chronic bronchitis, is almost always caused by smoking. Smokers are 10 times more likely to die of COPD than a non-smoker, and the problem is affecting more women than ever before.
Well, for a long period of time, it was predominantly a disease of men, but now we're starting to see that COPD is much more on the rise in women, and we think that's because more and more women are smoking.
Dr. Mark Hoffman says the symptoms can come on gradually. Coughing, thick mucus, it becomes harder and harder to breathe. It leaves many sufferers unable to do much at all.
When it hits at its worst, I cannot breathe. I don't have any energy. I tend to lay in the bed. I just can't get up.
For a long time, Becky Scott did smoke. Smoking is a primary risk factor for COPD. Even before she was diagnosed, she knew she had to stop.
I just got to feeling bad all the time. I had a terrible cough. My husband had quit. So I just decided for my health that it was best that I quit.
The American Lung Association says even though there are more men smoking than women, more of the people killed by COPD are women. And women have outnumbered men in that statistic for several years in a row.
So it's much more important now for women to understand that if they smoke, they are more likely to develop chronic obstructive pulmonary disease, and their disease process could be worse than that of their male counterparts.
COPD can't be cured, but it can be managed. In a previous Smart Medicine, we introduced you to a new program at Baptist Memorial Hospital, DeSoto, Outpatient Pulmonary Rehabilitation.
It's a programmed approach where you have a respiratory therapist, you come into an approved pulmonary rehab program, they do an appropriate evaluation, and then they start working you in terms of exercise.
Therapists put patients through breathing exercises, helping them learn new ways to pull in enough air to deal with their shrunken airways. But that's not all.
What rehab does, it allows you to have more stamina. It allows you to be able to do more. The way they do it, they give you a certain amount of time on each machine.
Scott has gone through the rehabilitation program twice. She has to use oxygen, but rehab makes her able to keep going to work. Dr. Hoffman says that although it may seem counterintuitive, rehab can actually give sicker patients better results.
But everybody is different. Certainly some patients will have a better response to therapy than others. Usually the more severe the disease, the more likely it is you're going to see a greater improvement in your conditioning and in your lung function at that time.
The rehab can improve patients' quality of life, but years of smoking can cause irreversible damage. If Scott's lung function continues to decline, she'll need a lung transplant.
It's a good thing, and it's also a scary thing. It was a very hard decision to make, because there's no guarantees. But that's in somebody else's hands. That's the way I look at it.
For Smart Medicine, I'm LURENE CACHOLA.